Hi, I'm Phil Kambic, President and CEO here at Riverside, and with me is Dr. Keith Moss, our Chief Medical Information Officer. And we've got a great announcement to make today. How we act as a health system is changing, and we are developing tons of outpatient facilities, outpatient campuses, outpatient services. We're adding to our post-acute care environment. We're adding memory care, assisted living. We're adding behavioral health services. And we continue to upgrade our main acute care hospital, Riverside Medical Center. All of that is helping to meet the changing needs of the healthcare environment. But one thing that we haven't done yet is how do we integrate all of those pieces together? And we integrate them with software and with information technology. So today we're very pleased to announce that Riverside has signed a contract with Epic, and Epic will become our new software vendor throughout the health system. So Epic is going to replace McKesson, QuadraMed, eClinicalWorks, and a variety of other systems. Many of our big partners, hospital partners to the north, the academic medical centers like Rush, Northwestern, U of C, all use Epic today, and Riverside will be joining those ranks. And to talk a little bit more about that is Dr. Keith Moss, our Chief Medical Information Officer. Keith?
Thank you, Phil. The key to the implementation and to why we're doing all of this is basically can be summed up in two words: one record. We will now have one record, one medical record for all of our patients, so that no matter where they are in the continuum of care, you will be able to find out what's going on with your patient. Different physicians will be able to have access to the record, whereas now they have to look in disparate records where they're not always able to find the information that they need. There's a great deal of importance to that in terms of efficiency and especially in terms of safety, because everyone will know where what has happened to a particular patient at a particular time. That's one of the key reasons that we're doing this. We feel that we are going to make a much safer environment for our patients, because what we can do now is be able to see what has happened to them no matter where they're at. I feel that this is one of the most important things we've ever done. It is going to affect every aspect of care. It will impact every level of our organization. And I think it will do so in a very positive manner. It's used because they are able to access records at any time, at any place. And we are doing this because we want that same kind of functionality for our patients. We are entering into an era where the patient is going to be much more participatory in their own health care and in making decisions about what they do. And in doing so, they will have access to a lot more information that we will be providing for them. Epic's MyChart functionality will allow us to give them that information much more easily than we can do now. And it will combine the information that they get both as an outpatient and as an inpatient, so that there will be one place to go for them to look at their own records.
So Keith, as this project gets started, when's it going to start and when's it going to stop?
Well, we're going to have a start date of October 1st, where the training will begin. We will be training people throughout the year of 2015 with a go-live date of January 1st, 2016.
And then does the project end January 1st?
Oh no, the project will continue on, some would say into perpetuity.
So you heard a little bit about the project, what's going to be involved in the project. So how does that impact you? It impacts you significantly, because we need your help. We're actually going to have a casting call, and we would like many people within the organization, clinical and non-clinical.
So in addition to requiring technical staff, we will also require a lot of clinical staff to help us with implementation. We want to make sure that we emphasize that this is not an IT project. This is a project that involves all of us. Every person in the organization will be impacted by Epic, and every person in the organization will need to understand to some degree what we're doing. Having said that, there are going to be a lot of other opportunities for people to participate in the project, whether as technical staff, as physician advisors, as clinical staff who can advise us on exactly the best way to make this work for us.
So those of you with passion and interest and want to work with Riverside on this project, there will be a casting call coming up very shortly. You should see it posted everywhere, through email, through web blasts, etc. We would love to have you involved in this key project that really is vital for Riverside succeeding as we go into the future. Thank you very much.